Hello out there. This is Lisa Whitty Bradley, founder and CEO of Chicks with MDs LLC. Um, I'm going to just kind of ramble along for a little bit until we get a couple of viewers. Just to review, Chicks with MDs is a platform to educate, elevate, and empower both physicians and patients, as well as other healthcare providers and the general population at large. Um, I've been doing these Facebook Live broadcasts every other week since the publication of um, our new electronic book, which is the Essentials of Implementing the Next Wave of Healthcare Reform. And basically, it's just important for us to be empowered as healthcare providers. And the better prepared we are as healthcare providers, the more exceptional care we can provide to our patients. So I started this journey about 3 years ago in terms of reviewing healthcare reform. And the reason why is because 3 years ago, or almost 4 years ago now, I became a patient myself when I was diagnosed with MS. And once I encountered the healthcare field from a patient perspective, I had just a tremendous, even more respect for the patients that I cared for the better part of 4.5 years when I was in practice as a plastics and reconstructive surgeon. And although I still do plastic surgery and reconstructive surgery and wound care and primary care for patients, I am much more in tuned into what goes on in the healthcare industry because I have to deal with it from both perspectives, from a provider perspective and also a patient. So I started researching and learning about the Affordable Care Act because it was impacting me directly as a patient, and then my family, just because of our health care premiums and what we had to do. Hey, Dr. Temby, how are you? Thanks for joining us. I'm going to be coming out there to Peoria in about 2 to 3 weeks to talk at Grand Round, so I know I'm going to see you. So I'm just basically reviewing who I am. So I'm Dr. Lisa Whitty Bradley. I'm a plastic and reconstructive surgeon, and I have a business entity called Chicks with MDs, which is utilized to educate and inform both physicians and patients via social media, and then also in-person lectures and reviews. And you will see me in Peoria, Dr. Tim, because I'm going to be out there talking about exactly these topics. So tonight I had thought about doing basically another overview of MACRA, and then going through the difference between MIPS, which is Merit-Based Incentive Payment Program, versus APM, which is Alternative Payment Model. But I realized that what I really need to review first is the final rule. So when MACRA was first introduced in 2015, MACRA is the Medicare Access and CHIP Reauthorization Act. That was utilized, to replace the SGR, which is the Sustainable Growth Rate, which had been in place since 1997 and was utilized to determine physician/provider reimbursement. And unfortunately, the SGR had to be replaced because it kept threatening annually to cut provider reimbursement by up to almost nearly 30%. And so in 2015, the SGR was repealed and replaced with MACRA. And MACRA addresses Medicare patients, which is over 55 million Americans, and then also the pediatric population through CHIP, which is the Children's Health Insurance Program. And this new rollout of healthcare reform, which started January 1st of 2017, is the Quality Payment Program. And the Quality Payment Program only deals with that Medicare population, so 55 million Americans over the age of 65. So if you're a provider, which includes physicians, advanced practice nurses, including clinical nurse specialists, nurse practitioners, certified registered nurse anesthetist, and also physician assistants, then this will impact you. And so the quality payment program basically enforces that quality markers will dictate reimbursement. So there have already been quality markers that have been implemented for a number of years, including the electronic health record system or meaningful use. However, with the quality payment program, you have two pathways. And so I was going to review that this evening, but I really think that we need to review the final rule. And the final rule was released by CMS, which is the Centers for Medicare and Medicaid Services, in October of 2016. And it basically provided what the pathway and what the layout of this quality payment program would be. So I just want to review some of those things just to make sure that we're all on the same page. And I have a list of things that I want to review because I want to make sure everybody knows what's in that final rule. Hey, Dr. Vicky, how are you? Thanks for joining us. So I'm just laying out what we're going to discuss tonight. And I thought that we would discuss the two pathways of the quality payment program, which is MIPS versus APM. But what I'm going to do tonight is review the final review released by CMS, because that will lay out the timeline and also what you really have to do to be compliant even before you know which pathway you're going to participate in. So the final rule, which was released in October of 2016, number one, it states that you can pick your pace of how you participate in the quality payment program. And this is extremely essential because prior to this, providers were just told the quality payment program starts January 1st, and if you don't comply, you're going to have a negative 4% reimbursement rate starting in 2019. So, I mean, everybody was just kind of like in a panic. But with the final rule, it's dialed back on your participation. So these are your options in terms of pick your pace for participation in the quality payment program. Number one, you can do nothing. So you can provide no information, don't follow the quality payment program at all. And if you do that, you're guaranteed to have a negative 4% reimbursement rate starting January 1st of 2019. Okay. The next option is to provide information for one patient and one quality marker. And if you do that, you're either going to have, you're just going to have a neutral reimbursement. So your reimbursement won't be negatively affected. And thanks, Dr. Vicky, for sharing. I appreciate that. So that's the next option. One quality marker, one patient. And then if you do that, you'll have a neutral reimbursement. So you won't have a negative impact, which is essential because, as you know, especially for private practitioners, you rely on every single dime in terms of your overhead, employing your staff, employing yourself, making sure that your lease or your rent or your mortgage is paid. So it's essential. The next option is to participate for 3 months, okay, for a 90-day period. So, hello, Dawn, how are you? Thanks for joining. So if you participate for that 90-day period, that means for all the patients that you encounter on that 90 days, you submit the quality markers as dictated by the quality payment program. And you'll have 6 quality markers that you'll need to submit for those patients. And I'm going to give you some critical websites at the end of this webinar, and it's not going to be long because I know I have ADHD. I can't pay attention. So I try and keep these short and sweet. So the third pathway is that 90-day period. So you have anywhere from January 1st to October 2nd to be able to qualify for that 90-day period, because October 2nd is the last day when you'll have enough time to submit 90 days of data. So you submit the data, and we'll go over where those quality markers, do you only submit, correct. So only for, right now, it's only for the Medicare population. So if you're taking care of Medicare patients, then you have to comply with these criteria. And I think that they did that because ultimately, as you know, the government dictates the insurance insurance programs or companies' reimbursement rates. So they're starting with the Medicare population. So this is just for Part B Medicare patients, not for pediatrics, not for private insurers, unless you have like Medicare Advantage. Then you're still going to be in that Medicare Part B population. So that's your outpatient procedures, preoperative workup, that population. So so we're still on that third, your pick your place, your third criteria. Hey, Dr. Bonnie, thanks for joining. So we're talking about the final rule of the quality payment, based on the final rule for MACRA in terms of the rollout of the quality payment program. So once again, just to summarize, so far you have 4 different pathways that you can pick your pace. The first is to do nothing, in which you guarantee that you have a negative 4% reimbursement rate starting January 1st of 2019. And then number 2 is to submit data for 1 patient and 1 quality marker. And if you do that, then you'll have at least a neutral reimbursement. You won't have a negative reimbursement rate. And then number 3 is the 90-day submission of quality markers for your patients. And you can do that anywhere from January 1st to October 2nd of 2017. That way, that October 2nd cutoff is so that you have 90 days to accumulate that data. And then number 4 of the pick your pace is to submit data from January 1st to December 31st. And that way, you, number 1, will not have any chance of negative reimbursement, and you'll have positive reimbursement. The highest rate you can get across the board is 4% positive reimbursement. And all of these reimbursement rates will take effect in 2019. So when you submit this data, and you have up until March 31st of 2018 to submit the data from 2017, and then you will see the change or the report of your data starting January 1st of 2019. Okay, so I hope that makes sense. Also, another reason why I'm going to give you these websites is that the Centers for Medicare and Medicaid Service, it's a dynamic process. So they literally will change things from week to week and month to month, which is really why I want to do these every 2 weeks, so that any rollout changes, I can let you guys know right away. Oh yeah, okay, so the data needs to be submitted to CMS. Now, of course, they have not exactly clarified how every provider needs to submit data, but right now you have a couple of options. Number 1, if you are already part of a qualified clinical data registry, which they were doing with quality markers prior to the quality payment program, then you can continue to submit data that route. Another route is through your electronic health record system, and you need to make sure that this is confirmed. Your electronic health record system needs to be compliant with the quality payment program. It needs to be compliant with the Centers for Medicare and Medicaid Services. So how do you make sure that your system is compliant? I'm glad you asked. So if you go to www.qpp.cms.gov, there will be in the upper right corner, there will be a tab, a drop down, and you can look under quality markers, quality program, and they will tell you how to go to and find out whether or not your system is compliant. And I'm going to do, this is a whole chapter in the book, so I'm going to do a whole webinar, a whole Facebook Live post just on that topic. So You have your electronic health record system. You have the quality clinical data registry. Also, if you are in a group practice, you will have a separate route to submit this data. Thank you so much for putting up that website. That is so essential. Yes, thank you very much. And to be honest with you, I've been researching this data for, like I said, 3 years, and this quality payment program website by CMS is by far the easiest to navigate, the most logical, and provides the best information. I mean, I can't even tell you how easy it is to review this because I have a head like a brick. So it takes me multiple times to understand things and for things to clarify in my mind. And this website, qpp.cms.gov, is just key. Another website that you can use is just www.cms.gov. Oh, how do you get my book? So you can either go to my website, www.chickswithmds.com, or you can get it through Amazon. Thank you for asking, Dr. Vicky. And so if you have the book, at the book kind of reads like surgical recall and medical recall and all of those books. It's question and answers. And at the end, usually at the end of each question or a major question, I have a website link. And at the end of each chapter, you have website links to reference all of these things that we're discussing. And the website, the book updates every 3 months. So if you have the book from my website, I will just send out a blast and give you a code so that you can get the most updated book. And if you get it from Amazon, you just let me know, just give proof of purchase that you got it from Amazon. And then I will give you the code so that you can get the updated book, because I think it's really essential. Hey, Kim. Oh, Brooklyn in the house. So if you, it's essential that you stay up to date. No, Dr. Vicky, you're amazing. And I haven't seen you on Periscope, so I know you need to get back on there. Okay, so I don't want to get sidetracked. Now, the other thing with the final rule, we talked about the reporting period. Your 2019 payments are determined by your 2017 data. We talked about the deadline for submission, your quality markers. Now, in terms of providers, okay, in terms of your providers, who it has to comply with the quality payment program. So you have two routes. You have your MIPS, which is the merit-based incentive payment system, and then you have the alternative payment model, which is APM. So if you're in an APM, you're going to stay on that pathway, and the APMs have existed already. So if you're already in that pathway, and APMs are like shared saving programs or your accountable care organizations, and we'll do a separate Facebook Live on that as well. I don't want to start listing a whole bunch of different data and people are sending me messages. I'm sorry. It's just essential that we stay on course, and I don't want to bring up too many different topics. But if you're in MIPS, which is the merit-based incentive payment system, you are going to, the providers that will have to participate in the quality payment program are your physicians, your advanced practice nurses, which are your clinical nurse specialists, your certified registered nurse anesthetists, and also your nurse practitioners, and then also your physician assistants. So if you fall in that category, you have to participate in the quality payment program via those two pathways, MIPS or APM. And by this point, I hope that even if you're in a private practice or you're employed, that you know whether or not which pathway you're going to participate in. I'm praying that you do, that your practice or that your hospital has informed you at this point of which pathway you're going to be pursuing. Now, who's exempt from participating in the quality payment program? If you're in an alternative payment model, you're already on that pathway. Okay. Now, if you are a provider and you're not in an alternative payment model, meaning like the shared savings programs, the accountable care organizations, then you are more than likely in the MIPS pathway, unless you are number one, a first year Medicare provider, meaning this is your first year in practice, and you've never seen any Medicare patients before. You are exempt, period, dot. I don't care if you bill $5 million in Medicare. If this is your first year in practice, you are exempt. Okay, good luck and enjoy. Now, number two, if you bill and collect less than $30,000 in Medicare, you are exempt. Less than $30,000 for the year, you're exempt. And the last is if you have less than 100 Medicare Part B patients. Okay. So I know now you're like, how am I supposed to know if I'm going to be less than $30,000 or if I'm going to be less than 100? Well, you don't. Okay. But if you're if you can look at your last 5 years and see, I'm a cosmetic dermatologist, I only see one Medicare patient per year. Well, then you're exempt. Okay. You're not going to bill $30,000 and you're certainly under 100 patients. But if you look at your last 5 years and you're trending that you're seeing 500 patients, 105 patients, 300 patients, you can pretty much guarantee your practice grows and progresses. So you're more than likely going to fall into these lines. Yes. ACO or that. Yes. Thank you, Dawn. You are killing me with the essentials. So that is correct. So those are the major things in your final rule. We talked about the timeline. We talked about what criteria for those who are going to be included in the quality payment program. And does anybody have any questions out there, or has anybody experienced anything in terms of implementing this already in their practice? Or, are your practices or your hospitals, are they keeping you up to date? Because I'm finding more and more folks who are still not educated about the quality payment program. And to be honest with you, I'm extremely frightened by that, because even if you don't plan on participating right now, you really need to know how to implement this into your practice. So anybody out there who is already submitting data or already utilizing the quality payment program websites, anything? Bueller, can you talk about QRUR and the importance of checking that now? Now, QRUR, I've been researching for a while. Give me the QRUR breakdown. What does that stand for? I have a solo practice and I'm nervous because I don't know how to implement. So, Dr. Dawn, I'm waiting for your response to that QRUR because I haven't seen that. I have a solo practice. Okay, Dr. Vicky, what you and your practice manager need to review is, if you have a general derm practice, then the likelihood of you seeing a whole bunch of Medicare patients and qualifying to participate in the QPP is high. So I would, number one, look at your data and see how many Medicare patients you've been managing over the last, 2 to 5 years. And if you're over that 100 patient mark, or if you're over that 30K per year, then I would plan on participating. The other thing is, you should be a member of the Chicago Medical Society or the Illinois Society. The Illinois State Medical Society. And they have had webinars going on, at least for the last 6 months, about implementation of the quality markers and the final rule and QPP. And there's actually another one coming up on January 17. So definitely plan on participating in those things. And I think what you need to do is review QPP .cms.gov. And what, I'll look, we see a fair bit of Medicare, so I think we need to participate. Yes, you do need to participate. And Dr. Dawn, I don't know what happened to your message, but I have just missed it. Just put, don't even put like that long sentence. Just put the definition of QRUR, and then I'm sure I can answer it for you. But your message vanished before I could even see it. I think you probably do need to figure out how to implement. Hopefully, you have electronic health records in your office, and if your EHR is compliant, which I hope they are, then you should be able to submit your data through your electronic health record system. And if you have a software representative, I would talk to them. I don't know if you have Epic or what you're using, but definitely find out from them. I'm sure that you're not in the Qualified Clinical Data Registry because most practices have not been in that, so you probably won't submit your data that way. Hey, Gina, I'm going to be coming out to Peoria soon. Yeah, Clinical Works is compliant. Well, good. Then if you have eClinical Works, I would talk baseline quality and utilization report. So if you have the QRUR baseline quality and utilization report, if you are submitting, are you talking about like a qualified clinical data registry? Because if that's the case, you should be able to submit your data through that service. And if you're talking about the quality and utilization report from your practice or from your hospital, they should be able to give you data that gives you numbers in terms of whatever your reportings have been in the past. And I don't know if your baseline reimbursement has been adjusted based on that. I'm not sure, Dr. Dawn, because can you clarify what you're talking about in terms of that QRUR, whether or not you're going to still utilize that pathway or what the exact question is? Because one of the authors in our ebook is actually still in the CMS system, meaning she works in that system, and I have not come across the QRUR yet in our discussions. So give me your question again and I will get it answered. I'll go back after our talk tonight and look through and talk with her, and I will get that answered for you because this is the first time I've even encountered that. So just in overview, make sure that you guys, okay, it is a baseline reporting for every provider. Okay. So basically, if you've been utilizing that already, then you should already have a pathway to submit your data to CMS. And if that's the case, the reports from CMS on just www.cms.gov and on qpp.cms.gov is that if you're already reporting through a system, that you should be able to just continue submitting through that pathway. So it will probably be a much easier pathway for you versus somebody else like myself or like Dr. Vicky, who has not been participating at all, except through electronic health records compliance. So you should be able, if you've already been submitting data, you should be able to do that, to continue that pathway, because you should already have a link to CMS, whether it's dealing with the regional representative in your area, hopefully. And if not, but I would still make sure that whatever pathway you've been using, that it's still compliant. Because another thing that I found out through creating this ebook is that even if you have an electronic health record system or a submission process that has been compliant with CMS in the past, because you have this new pathway of information, you may not be compliant as of January 1st. And you may need to adjust what you're submitting, the data that you're submitting. And another thing that you can find out through qpp.cms.gov is what quality markers you're going to be submitting, because based on your specialty or your position, the quality markers that you're going to submit on your patients are going to vary. So just make sure that you review that site. So, Dr. Dawn, I'm going to make sure that I get this question clarified and answered because you've stumped me, which I love. And then next time, which will be 2 weeks, we will discuss in depth the 2 pathways. And we're going to start with MIPS, which is the merit-based incentive payment system, because that's what the majority of providers are gonna take in terms of submitting their data and taking care of patients. So we'll start with that because to understand how they break down the MIPS is a bit confusing at first, but the more times you review it, the more you will understand it. For how to obtain QRUR for your practice. Cool. So I will get that answered, and then I will answer your questions later on tonight. So just to make sure we're all on the same page. So does anybody else have, excuse me, anything else to state or ask? No? Okay. Thanks everybody for participating, and I'll talk to you in 2 weeks. Take care. Bye.